right, welcome to Peeps Creek, the cafe where we serve you delightful, slightly intense, but definitely worthwhile conversations. A podcast focused on bringing people together by drinking, listening, and conversing. So grab your favorite drink and let's see what's on today's menu. All right, people, welcome to Peeps Creek, the cafe. You know, here at the cafe, we always have a conversation centered around the drink. And today I did something a little special, y'all. I have a new espresso machine in the cafe. It is by Dietary Cafe. It's pretty good espresso, automatic espresso. So I made me espresso martini. You know, I always have my little trusty bottle of water, H2O, boom, boom, boom. And today I am joined in the cafe by Jay. Say hello.
Hello, everybody.
All right. Now, let me go back to me because I'm more important. Thank you.
Oh, my God.
You are on episode 60. Episode 60 is entitled Health and Wealth in the Black Community. And you know, here, I normally start off the conversation because, hello, it's my show. Duh. And what I say, go. But we're going to do something a little different today. We're going to kick it back over here to Jay. Jay, what are you drinking on?
I am drinking the espresso martini also that you made for me. So
Have you tried it yet?
I haven't. I was waiting on you.
Oh, well, let's do a cheers. Cheers from the distance.
Chin chin.
Chin chin, clank clank.
Salute.
To the people. This goes out to my homies.
Oh, for your homies. You pouring it out. You got to pour something out for the homies.
Look at that. Tastes pretty good though, right?
It's good.
You want to say thank you or it's free of charge?
I mean, you're not paying me to be here. The least you can do is give me free alcohol and hookah.
I mean,
that's the only payment I'm going to get, apparently. So I don't know. But
folks come into your studio and try to take over. Right? You know, most people charge for studio time. Huh? All right. So go ahead. So what are we going to be talking about today?
So as you noted, I really want to talk about health and wealth in the Black community because there is an absolute correlation between the two, right? One impacts the other significantly. And it's something that doesn't often go together, right? In the Black community, health and wealth. We either have one or the other.
Muscles, baby. Boom.
Oh my God. We either have one or the other or neither. So I think it's important for us to talk about this.
All right. So, and for purposes of the conversation, I think it's important that we give a full disclaimer. Neither one of us are public health officials. Neither one of us are medical doctors. However, what we do want to talk about, I think, is the anecdotal experiences that we have experienced in our families and talking to families and friends about the topic offline and just kind of bring it online.
Right. We aren't sociologists. We aren't statisticians, right? We're not necessarily going to have empirical data for you on this topic. But
although I did take sociology because I was a criminal justice major and I wrote my published paper was in the sociology. What's that magazine? Not the magazine, but article, journal. But go ahead. So technically I could say
okay, irrelevant, but let's move on because I only have so much time tonight. I got to get up and go to work in the morning. But yeah, so we don't have the hard data, right? But what we do have are our experiences and our observations and our placement in a community that suffers greatly from not paying enough attention, I think, to either of those topics and not necessarily making the connection between the two. Would you agree with that?
Yeah, I think that for me, particularly growing up, having health benefits was not a priority, period, right? We went to the doctor when we needed to because we had to, not because we were going necessary for preventative measures, right?
Chris Rock said put some Robitussin on it. That was their
I
medical plan.
would tell you, growing up in Detroit, if you were sick, you get some Vernors, right?
What's that?
Vernors.
What is that?
Ginger ale. Oh, Vernors.
Ginger ale and crackers. That is the Black people's remedy to whatever ails you.
Not the Seagrams and all that crap y'all drinking down here.
You talking about off-brand?
No, Vernors is the real deal.
Ginger ale.
It is the real deal. And here in the Virginia area, you only can find them in select stores, and it's a 6-pack, and it's like $4 or $5 for the 6-packs. But it will heal.
Whatever.
Stomach,
heals you.
Flu, cold.
Leg.
Listen, it took care of it. Then if you had a little cough with it, my grandma used to go and put some of that that whiskey in there. or
And
brandy.
how old would you have to be for that? It didn't
Oh, when I
matter.
was a kid, put that brandy in there, put that little brandy in there, because then that's gonna clear that throat.
That explains it. Okay. Bringing the
But go ahead.
giving the babies liquor and alcohol.
It worked.
What about this shortage of formula crisis? That's a whole other thing, because there was an article the other day that talked about how it is impacting Black families more. But we will find a way, because what I have also seen are these multitude of postings where people are like, well, here's another recipe. If you don't have formula, you get that evaporated milk. You put a little whatever in it, put a little corn syrup and this, that, and this. And there was one discussion that was going back and forth about how one lady was saying, my baby's only 3 months old. My doctor, my pediatrician said, I can't give her that yet. It's not good for her. And they were like, do you want her to eat or not?
I mean, yeah, because I remember when Davion was little, his mom was more focused on following the rules, but not me. I'm like, look, he's crying because he's still hungry. The formula is not filling him up. We need to add something to that milk. Put a little cereal in there, shake it on up, and let it stick to his rib so he can stop crying.
To your point, one of the suggestions was put some rice cereal in there, put some other stuff in there to fill them up. But here's my question concerning those recommendations. Because people are like, we got that and we were fine. So this relates back to the whole health and wealth in the Black community. Mm-hmm. Okay, I mean, the doctors recommended against it, but they don't know all. It's a mix of art and science a lot of times. But if we are giving the babies those type of sugars and carbs at that early an age, mm-hmm. when it's recommended against when it's against doctors' recommendations, to what degree at all is that contributing to the child's development, where either we're laying a foundation later for diabetes, or an appetite that they have for sweets in particular, or just carbs to make you feel full, that then contribute to them having weight issues or dietary, lack of dietary control, that kind of thing.
I mean, I hear you, but when you are in a community where you don't have the wherewithal, so you go to the store, you get the cheapest cereal, right? The 99-cent bag of cereal. That's not Fruit Loops, but they call Loops, right?
Right. And generic brand.
They have like 13 pounds of sugar there, right? But that's what we had to operate under.
I get it. And that's still the only choice for some people. And it's unfortunate. So I'm not judging and criticizing in that regard. It is still a question then, though, because we have to make poor dietary choices due to our lack of wealth and finances. How does that impact us, right? From the very beginning through our lives. Mm-hmm. And so why are Black people the ones who are carrying the burden of all these preventable diseases that we end up dying from? And a lot of it has to do with diet. And so again, it's like, well, is it that Black people don't have the discipline? Is it that we don't know to eat better? No, more often than not, most of the time even, it comes down to how expensive is it, right, to eat healthy. So that's one aspect, I think, of health and wealth in the Black community. Another aspect, our mentality and our approach to finances, right? Do we even think about it, or are we really just more focused on how we're going to pay XYZ bill? Now, I know it varies, right? Mm-hmm. This isn't a blanket statement for all of the Black community, and I certainly don't speak for the entire community.
I speak for the people.
Okay.
I'm like the Huey P. Newton for the people. No,
what would you have to say?
No, I'm Black.
No, but I think a greater percentage of us generally have financial, challenges where not only diet, but, the health of our finances is something we don't prioritize, right? We don't focus on it. A lot of times we don't like to think about it because we don't have enough, the money that we'd like to say this is enough for how I want to live. Mm-hmm. And so we just ignore it altogether. Do you find that to be true?
Yeah, I mean, I think so. I'm not sure we necessarily ignore it. I think we just, at least my experience is not that there's I know it's there and I'm ignoring it because I just don't want to deal with it. It's that I don't know how to navigate through it, right? Because I think you have to define, at least for me in my head, you have to define what wealth means. For some, wealth is I have a nice car in front of my house, right? For others, wealth is I get to have on nice shoes every time a new shoe come out, right? For some, wealth is how much money do I have in my savings? And then for others, there's the wealth, the concept of, okay, what does my retirement look like? What does my home value look like, right? So I think there are different categories of it.
Well, is
And
it fair to judge those categories? Like for some to look at it and say, for you to believe that getting the new pair of Jordans every time they come out makes you wealthy, there might be a problem there, because that is to me not true wealth. It might be in somebody's mind, but that's, I mean, when I talk about my sort of focus here today is about true wealth, building generational, excuse me, wealth, right? Creating a comfortable spot for yourself and your family where you don't feel like you're just living check to check and you aren't paying. I mean, some people have to do that, but you don't need a whole lot of money though to focus on saving, to focus on how do I multiply my money or how do I stretch my money. And so, but I don't think enough of us think about that at all. It's just, do I have enough to acquire this material item? Is that enough for me? Or, you know, are my aspirations only to achieve material things? Or are we really looking at it in terms of generational wealth?
I mean, so sorry, but not to make light of it though, but that's how I am. I do think it's important though that to recognize that the concept of wealth, as you speak it, right, of what you're speaking about, may not be what other folks believe wealth is, right? There are some folks who believe wealth is the emotional and, physical, metaphysical aspect of who you are, the being, that makes me wealthy. Because when I'm going away from here, I'm going up to the house and get 7 mansions. You understand? Going up the mountain.
Yeah.
Now, but to your point, I do think that, for conversations, one thing that I think we lack a lot of in our community is just having that open, honest conversation about where do we see us as a family unit going from here, right? I can buy this, that, and the third, but does that mean that that's something that my generations after me are going to be able to use?
How will it benefit them?
Yeah.
What can they take with them? And I agree with you certainly that mental well-being is wealth. I absolutely agree with that. So I don't discount what anyone would say about that. I think due to, just socioeconomic circumstances, a lot of times we can be limited as a community
Espresso's good.
in what we view as wealthy, or we don't even aspire to it because we think we can't. So I think part of this issue is about highlighting that I think more people need to have these open conversations, right? And really consider a moment of introspection and action, right? In terms of writing things down, figuring out what you need to execute when, how can you get from A to B? We just need, I think as a people, need to pay more attention to that and be less focused on just sort of the pop culture satisfaction that we may receive. Now, I'm talking to myself, right? At the same time, I'm talking to everybody else because, of course, you want the nicest thing that you can get. Everybody's trying to live their best. And it really came home to me with regard to health and wealth when my mother turned ill recently. She had a turn where she fell and then had a stroke. And there was evidence that she had been having a series of mini strokes. I had seen her cognitive skills deteriorating. And as an only child, it fell on me to navigate, this very complex labyrinth of networks and rules and laws in the healthcare field. And so it highlighted the fact that she and I had not had the conversations we needed to have about her estate, about how she wanted things handled. And part of that was her being very secretive. But part of that, I think, was also that she wasn't a rich woman. She's not a rich woman. And so, it just never really propelled either one of us, right, to have the conversation. In my mind, I'm always thinking, we'll have it later. We don't need to have it now. But I've run into that problem enough times and seen it enough times to say, by the time you get to the point where you need these things to be worked out, that is not the time to try to get it worked out. You need to have the conversations. You need to execute the paperwork. You need to have total ownership of your assets and your belongings and your property and whatever else. And so I just think Black people need to have the conversation more.
Using your situation as a springboard to this conversation, just to play devil's advocate, right? People may listen to this or hear this or look at it and say, well, she seems like she's well put together. Knowing what you know and being who you are, why didn't you force those conversations earlier on so that you could be prepared for the situation where you're forced to make determinations for your mom?
Combination of two things. One is just, procrastination, denial about needing to have the conversation. Part of it was, here's another responsibility on my list. If I don't have to take it up right now, I won't. And that was a mistake on my part, I will say, because again, you don't want to wait until you need this stuff to be in place before you get it in place, right? So part of it was just my overall resistance, whether it was conscious or subconscious. But my mother was also the type to not want to have the conversation. I mean, it took her brother, my uncle, passing, where there was drama with his estate because it wasn't fully settled and organized like it should have been. And it took him to pass for her to get a burial plot, for her to get she had a life insurance policy, but it was something she was like, I'm mailing this to you so you have it. Her entire life, she's been very secretive about any of her affairs. But his passing and the mess, the aftermath, right, that she saw from that motivated her to not want to be in the same position. So and then what's interesting about that is she started to get all that stuff together, and then she kind of dropped it. And I don't live where she lives, and I have a lot going on in other aspects of my life, and honestly, I just did not prioritize it.
Do you find, or did you find, based upon your experience, that for her there could have been this fear of thinking about mortality, right?
Oh, yeah.
Right. So why am I thinking I'm leaving here when I have so much left to do?
Because you got to get past that.
Yeah.
You got to get past that because everybody goes. So, I mean, people have their own issues with their fear of death and not wanting to talk about it. But we all got to leave here one day. So why don't you get your finances, your estate rather, in order before then? And another reason I wanted to talk about wealth and health in the Black community had to do with the fact...
Health and wealth, ma'am. But go ahead.
What did I say?
Wealth and health.
Oh, my God. So, anyway.
HW, homework. Go ahead.
Oh, you're giving us mnemonics now?
That's right.
Okay, acronyms. So, unfortunately, she went from someone who was living on her own fairly independently, although aspects of that, were changing over the last couple of years. Now she's in long-term care, can't do anything for herself. And so one challenge I was faced with was, where is she going to go? What facilities have openings that are qualified to take care of her and her condition? And how much is it going to cost? Yeah. Bottom line. And where are the resources? Because I will tell you, a minimum standard, minimum facility is, they were giving me $5,000 a month quotes
to fully take care of her.
Yeah, for the care. And it just went up from there. And so what I found astonishing was that you either needed to be wealthy, right, to pay out of pocket for these facilities, or you couldn't bring in a lot of money in order to qualify for Medicaid, which is just government assistance. Medicaid covers the cost when you don't, but you can't. There are caps on how much income you can make per month with that. And if you make over it, you can spend down and all this other stuff to try to qualify. But if you are an individual who brings in too much income just from your pension or your retirement, whatever, your annuities, any other form of income, if you make far over the amount to qualify and you have a multitude of assets that they will count, in against you, what are you going to do? But you don't have enough money to pay out of pocket
Right.
for these astronomical costs.
Right.
And so
But did you know whether, in your experience in doing that, because I thought I saw somewhere that, to your point, you're either on the opposite end of the spectrum. Either you too broke to think, and that might qualify you, or you make too much, and so you have to pay out of pocket. But for those people who are in the middle, right, who maybe have a good, decent income, whether that's through your salary or pension and things of that nature, and maybe you have some few investment properties here or there, including your own home, but you know that you can't live there anymore. If you begin to liquidate those assets,
Well, you have to.
do they take that into consideration as additional income that you're going to
Yeah.
receive?
Yeah. They end up, one of the workers somebody in the business office at the facility where my mother is said to me at one point when I started this process, she said, the people who work for Medicaid ought to work for the FBI because they will find, okay, anything and everything. And I remember there are a series of questions that they ask you, right, in the application process to get to the heart of what assets do you have. And my mother, again, this was before she fell, but still when she was declining, but just at some point last year, sold her car. She had a car that she hadn't driven. She suffered from neuropathy in addition to, I guess, these issues that were causing her to have strokes. And so she had stopped driving within the last couple of years. So really she needed to have sold the car long ago. Now she's 78 years old. She, all of this. So you would think she would have told somebody she was selling her car. She told no one, sold it on her own. But one thing the people asked me in the application process was about whether she had a car. I mean, they go down the line, right, with the assets. And when I indicated she had sold it, they were like, okay, we need the bill of sale because they want to know how much money did
Right.
she get, because they're making an assessment as to what is your financial situation
Right.
to qualify you or not. And I wasn't in the position where I had to sell off her assets because she does still have a house in her name that I have not had to sell. But they also sent me a letter saying Medicaid comes after your estate. So if I were to sell the house, it's not like I would keep the proceeds as her sole heir. I would have to hang on to that after she passed to see if Medicaid would come after it or not, because apparently they can.
Right.
So, and they hounded me about this letter. I was like, so because I
The
talked
bill of sale.
the bill of sale for the car, and I was asking my cousin who was helping my mother out, did they do a formal document? Did they do a bill of sale? She was like, no, the guy just gave me the money for the car and I put it in your mom's account. Like, what? So in the end, I ended up essentially having to write a letter, like a declaration almost, saying this is what I understand what happened. This is how much money, because they wanted to know how much money did she get for that car when she sold it. Car was old as dirt, right?
Right.
But they were tracking every penny because they have a 5-year look back period in all of this. And so if she had set up a trust, if we had set up a trust at some point, and I don't know, I did not think far enough into the future years ago to say, what am I going to do if, my mother needs this type of care?
Right.
Because it is something, from a human standpoint, you just don't like to think about, right?
Yeah.
But that's why I think it's important for us to say, no, you've got to have these conversations.
I just think in the community itself, secrecy is God, right? It is the only thing that we have, right? What we do, what we understand, our value, that's all we have for a lot of people. And so surrendering that is difficult. And then even having a conversation with your child, right, about, this is what I'm doing, this is what my health is. Like even with my mom, she's open about it now, but I know I used to get on her nerves because I would go home. Whenever I would go home or call her, I'll ask a whole lot of questions because in my head I'm thinking I need to know what it is. First of all, I want to know what you want. Because at the end of the day, that's what I want to ensure that we as a family unit honor, whatever your wishes are, right? If those wishes are reasonable and practical at that time, that's what I want to happen. But also, I think it removes the stress of being catapulted into a situation where your emotions are running over your logical thinking, right? And I think for the Black community, we often move from emotion and we often have to make decisions
Absolutely.
based upon emotion. And then we have all this unnecessary infighting with each other
Drama.
because it's like, Big Mary didn't want that. Big Mama didn't want that. Big Mama would not want this. And I'm like, okay, if Big Mama didn't want that, why didn't you sit down and have Big Mama write it on a piece of paper?
Because let me tell you how when people start fighting over what's left.
Right, exactly.
People not even gone yet.
Yeah.
They're at the hospital and there's people at the house
Yeah.
taking things out, fighting over jewelry, fighting
Yeah.
over furniture, fighting over whatever.
Yeah.
A rubber band.
I mean, because there's so many, we also get weirded out by the whole legalese aspect of it, right? But there's so many things that you can do simply in your own home, right? You could take a pad and a paper and write it down and have some other person sign and say they saw you write this on this day. This is where we were, blah, 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 right? Could it be contested? Yeah, sure. But at least that's something that is going to say, this is what this person's perspective is, right? Or if my son is 17. So I have these conversations with him all the time. When I feel like, I feel like I'm sick or whatever, I tell him, here's are these accounts. This is where this stuff is. Your name is on this, that, and the third. Because I want him to know if push comes to shove, these are the things that are for you. You know what I mean? And you can do what you want.
But it won't be a mystery. He won't feel lost. He
Right.
won't be unsure of what your preferences are.
Right.
Because my mother and I had to have the medical conversation as well, right? Do you want a DNR in place? And surprisingly, she was like, oh, no.
Right.
Keep my heart beating. Do whatever you can to get my heart beating. But one thing which was a little surprising to me, but one thing she was clear about was that she did not want machines to keep her alive. She said, I don't want to be hooked up to machines and machines keeping me alive. She said, if I'm that far gone, just let me go. Right. So we did have that conversation while she was of sound mind, but it was while
you better keep me here.
But it was while she was in the hospital. Okay. And it really was a conversation we should have had way before then.
Yeah.
You said you want to be hooked up for the next 20 years
Bruh.
because you might come back.
Keep me right there. Keep my microphone next to me just because I want to get up and do a podcast, episode straight from the bed. But yeah, no, there are so many simple things that you can do to navigate through the system to honor the requests of your loved ones, but also for your own sanity, right? But I do think that with Black folks, particularly, we have to fight with each other to have those conversations. And that in and of itself is a stressor, right? And so it's easier to say, well, screw it, I'll circle back to it. But, oftentimes we don't circle back to it because we don't want to deal with the drama. She ain't listening or he ain't listening, or the parents, if they're older, they start thinking, oh, just because you went here, you think you uppity, you think you know this, that, and the third.
Right.
So
there can be a power struggle
where
they will not accept, because you're of the younger generation, they're just not going to accept that you have something that's valid to say and that your idea may actually be better than what they were thinking or what they intended to do. I mean, I don't know how you overcome that, but I think we start to push past, those barriers the earlier we have the conversations. And again, to emphasize and stress, like, this is for your own well-being, because if I can talk to you about how to just better handle your finances or grow your wealth, then maybe that connects to your health, and then maybe you don't have to work until you drop dead. Maybe you can actually retire and enjoy retirement. There are so many Black people who have no pension, no annuity of any kind, no 401k that's, worth talking about, where they could retire at 65 and live comfortably. I think it's far more common in the Washington, D.C. area. And I think that has a lot to do with the government. And so you have a lot of Black people who are living middle class and upper middle class lives where they wouldn't otherwise. And so with the government, you're going to have the annuity.
Because you got that good government job.
I think for this area, I certainly, see Black people who are growing wealth, who are passing along generational wealth, and it's largely due to the job market here. Because not only do you have government workers who have essentially been able to make the type of money that they would make elsewhere, you got a lot of people who are independent entrepreneurs. They have contracts with the government. Right, that's another moneymaker. Yeah. IT, a lot of that. And there's the small business, requirements, right? That a lot of contracts have, small minority business requirements that end up benefiting a lot of people, a lot of minorities, people of color, women, that type of thing. So that contributes. But this area, I think, is an anomaly, right? Like, I think you can get comfortable believing, oh, this is how it is for Black people on the whole. The majority, and it seems not to be.
Yeah, so I mean, I guess to push the envelope a little bit, for those folks, let's just stay in this area, right? We have a lot of folks who are able to quote unquote live the American dream, right? And be able to manage their health and wealth a little more efficiently than maybe they would have been able to if they grew up how they grew up, right? If they lived how they grew up. But is there a requirement, an obligation for that group of folks to then go back to reach back into the community to try to instill in other folks about the value of health and wealth in the Black community? Because sometimes what happens, I think, with a lot of families is that there are a few nuggets of successes that come out of them, right? And then you go back home and there are folks who are still living horribly, right? But at what point do you have an obligation to try to break that cycle, to steal from a Yana Van Zant, to break generational curse, right?
So I think we all really, whether we want it or not, sort of have the obligation, right? Because Black people on the whole in this society in America are just not where we need to be. And that's due to a lot of outside factors. But I also think the way you give back varies. So first of all, one person can be a savior. So because I think a lot of times we have that one person in the family who was the only one to get the college degree, or I think it's changing as generations pass. But, we've had for a long time, oh, he or she was the only one to go to college and go to law school or whatever, go to professional school, just do well.
Right.
Open your business, do well. And then everybody else in the family who has nothing expects you to be the resource for everything that everybody needs. That's not realistic. That's not fair to the person. And so for as much as you can appreciate your blessings and want to help other people in your family, you can't do it for everybody. But
if it was for me, you wouldn't be here. What about that?
You just got to pray for them. You just got to be like, I appreciate you. Okay. I appreciate you and everything you have done for me. But the other thing is, there are different ways.
I sacrificed for you to get to where you are.
God's gonna bless you real good for that, right? So one, like it just varies in the way you want to give back. Where you may not be supporting a family member, you could dedicate your resources elsewhere that will still contribute to the upliftment of the Black community.
So while we're on this topic, though, of health and wealth in the Black community, and let me just say, I know that it's a broad topic, right? Because it means a multitude of things.
Sure.
But one thing that I do think I want to stress on here is the need for you to recognize the fragility of your own mental health, right? Because oftentimes what we tend to do is that we put ourselves in detriment for other people too often, right? Because we feel like there's an obligatory aspect to it, or we feel like, I have to do this because someone did it for me. And I get all that, but if you're not mentally prepared or strong enough, then you can't, I feel like you're selling a bag of rocks to people because you're not prepared your own self. You know what I mean?
Right.
You
Or
have to have that mental wherewithal in order to move through the system
Or you
yourself.
could be strong enough mentally and the situation damn near break you, right? So back to taking care of family members and this obligation that we have. Some people ask me, were you going to move your mother up here with you? And
Because I surely did.
you were not the only one. But I don't fool myself, right, into believing that I can provide the type of care that she needs. First of all, she needs round the clock care. Like, she can't do anything for herself. So who exactly is going to pay the mortgage for the house that you want me to move her up here into if I'm not working because I have to be home? And you go, well, you can still work. You can hire a nurse. Well, who's paying for that? Because another thing I realized is insurance doesn't cover everything at all times.
But you can take FMLA for a little bit.
And you're not paid. So the Senate, not the Senate, but Congress on the whole, right? In their legislation that's been pending or somebody's been trying to get off the ground to have
Paid family leave.
because a lot of other countries do it. Same thing with universal health care. We always think everything's so impossible and it becomes a socialist agenda, right? But it's like, at what point do you recognize your obligation as a country to take care of your citizens? So, but they haven't passed that yet, right? They don't have enough support for it. So I'd have to take off from work. And besides the question of who's paying these bills, if I'm taking care of her, I recognize I don't have the qualifications and the skills. She needs nursing care. She needs medical care. And I wasn't going to let any notions, right, of obligation and guilt override the reality. Because what you don't want, to your point, is for both of us to be in the bed, right? Because she can't do it and I've been so run down. So that helped me do by dismissing this notion, entertaining this notion that she would come up here and be with me, is that then I was able to focus on, okay, how do I get her what she needs where she is? And thank God I was able to do that. It really was a blessing. And things came together. I mean, at one point it was harrowing and it was a bit overwhelming.
To the other point of a stress related to trying to take care of family, like there is a perception, right, that I'm referring to it in the colloquialism that I understand, old folks home, right? There is this perception of folks just sitting in a old folks home withering away and no one is really taking care of them or giving them any kind of fair treatment or making them feel as if they're still alive, right? And so for the point of the familial obligatory aspect of taking care of loved ones, some of that stems from that fear, right? Because the perception for a lot of us growing up, I mean,
They're
for
not
me,
going to treat them well.
they're not going to treat them well, right? They're not going to treat them right. They're slapping the back of the neck. You've seen, like, there's elder abuse and, there's there are lawyers. That's all they do is litigate elder abuse cases, right? But remarkably, there is, what I understand, most of the elder abuse cases are from
the loved ones.
Hello.
And here's the thing. And I know this is rooted culturally, and I know a lot of it has legitimacy, but we have got to stop assuming that we are always getting the bad end of the stick and that people are always going to mistreat us, because that's part of what's rooted in I can't trust a home. Why can't you? Have you researched it? What kind of ratings do they get? Now, in the end, they got the best ratings and still, mistreat your loved one or do something wrong. But you can't just always assume that.
But sorry. I agree, but let's be realistic. That's very difficult to dissect. Where if you have, I mean, you can be, hell, I can go to a place in DC and feel like I'm not good enough, right? I've had those experiences. And I make sufficient enough money where I should be able to walk in this motherfucking place and be treated like a king, like everybody else.
Like I said, it has legitimate roots.
Yeah.
But it paralyzes us in far too many circumstances to our detriment. Don't even get me started on people who won't get the vaccine because of the Tuskegee experiment. I get it. I understand it. But you got to get past some of that bullshit to help yourself. We can get in our own way. And so, just to your point of people who would take someone in just because they don't trust the facility. you got to look at it on a broader spectrum than just assuming they're not going to be treated well because they're Black. And balance it against, well, what will it mean then for you to bring someone home?
Yeah.
What's the cost to you there?
But you also, I do think you and we have to recognize that we've have lived experiences that other folks in our community don't have. So part of the ability to grow, I think, is the lived experiences. You've moved out. There are some folks who never left the block that they grew up on, right? They never crossed the fucking border to,
To go out of state.
Go out of state, or sometimes to go into another city.
I dated a guy for a while, for a long time, that was from New York. But let me be specific. He was from Queens. So we would go, we lived together for a while here in DC, in the DC area. And, so we'd be in New York every other weekend, like hanging out. And I'd be like, okay, when are we going to Manhattan? What is happening? And he'd be like, oh, well, he wouldn't know what to do. I was like, huh? And he'd go, well, we don't really. I mean, people in these boroughs have everything they need within a 5-block radius.
Right.
And some of them never even travel outside the borough. I was like, what are you talking about? So, yes, absolutely. There are people who never leave the neighborhood. They never leave the state. They haven't been exposed. And so I get it, and to that, I would just say we have to do more to sort of work on freeing our minds.
There's a discussion that should be ongoing in the bars, in your barbershop, and when you're going to get your liquor, who you go and play basketball with, right? Every time you meet someone, you'll be amazed of how your interaction with that person can be a positive influence on their way of thinking, on their emotional state, on their mental state. You never know what someone is going through. You never know what someone is battling with internally, right? Because to your point about the secrets, we also are clear that we shouldn't be telling people when we feel some kind of way, when we feel it in balance, when we feel like we need to cry. It's not meant for us to go and talk to anyone, right? That's something that we need to keep in, because you don't want people to think you crazy, right?
That's been a stigma that I think is changing. Like, I've often talked about how my second career will be in psychology as a clinical psychologist. And one of the reasons I'm drawn to that field, I mean, I've always been drawn to it, generally speaking, but really understood within the last few years that a lot of reasons, one of the main reasons, Black people don't necessarily engage in psychotherapy like they should, is because there are not enough Black therapists out here to treat them. And they feel like the white therapists, while they may be great at what they do, simply just cannot relate enough to them. So their advice, right, is coming from a certain place where the connection is lost, with a real understanding of how you can help me, because you can't understand the issues I'm having. So how can you provide the advice and support that I need to get better? Yeah. So people seek Black therapists, and there just haven't been enough.
No, I agree. There's not enough out there. And, on that last point is that even for folks who are woke or who's intelligent or well, I shouldn't use the word intelligent, but who was really educated in the area, it's not that white folks who are clinical psychologists can't render sufficient, well-sounded advice. It's just that for some folks as well, it's more of the same white savior aspect of it, right? Here there is another white person coming and save the day, right? Why
telling me what's best
for me and my situation and all of that. So there are a lot of things culturally that I think people don't connect with understanding why there's this dissonance with the concept of therapy, right? And so we get more people of color in there, and that goes to organizations too. Just saying like why people tend to think that diversity and inclusion aspect is this old woke movement aspect, but it helps the organization as a whole, right? The more people you have that look like you, that sound like you, that talk like you, walk like you, understood the shoes that you had to walk, the more likely you are to resonate with the organization, and then therefore want to stay, get promoted, things of that nature.
You feel like your opinion is valued.
Yes.
And will be taken seriously.
Yeah.
Yeah.
So, all right. Well, this was a good conversation. I appreciate you taking it. I also appreciate you taking time to talk about things that's personal, dealing with your mom. I know it's not easy having to be here and she's there, particularly in the state that she's in. So positive vibes for you and your family, and particularly for your mom. And so, so I appreciate you being here. All right. So for those of you out there who are listening, you know that here at the cafe, we always have a drink. So you always pull up your drink and have a conversation with us. You can do that. You can communicate with us on all of the links that I'm going to put up here, as well as the email. If you, maybe there's a topic, part of this conversation you felt that we misconstrued, didn't say right, or you felt like you have a different perspective about it, it's good that we hear about the different perspectives. So feel free to send an email. We can get you on. It can be virtual. You don't have to necessarily sit here with us. But until next time.
It's COVID. I don't know if they can come. They can call.
I mean, you out here in these streets all day, every day with no mask on.
I'm vaccinated, boosted, and I got Jesus on my side.
With no kind of shame or remorse or care. So next time.
The blood. I plead the blood.
Drink, listen, converse. Peace and love.
Bye.